Now we're going to review a little bit more in detail each of the four phases of the rehabilitation program, kind of from that Bruckner and Kahn text. Phase reminder, just kind of phase one is the acute phase of the injury or surgery or kind of post surgical care acute. Number two is kind of returning to ADLs. Number three is sports specific activities, returning to those activities, not returning to sport, returning to sport specific activities. Number four is preventing the re injury. Applying the framework for recovery is in phase three and four. But in phase one, each of these phases, they all have like a primary, secondary, and tertiary focus, right? So, what's the main goal of this phase? That's kind of what we're gonna review, right? And it's kind of in the title of the name, but there's a few little nuance pieces here. So, um, easy to get kind of lost in the weeds of this, but just reminder, right? Phase one, acute phase, right? We're controlling the exercises. They're very, very, very controlled. The primary focus of phase one is regaining active and passive range of motion. That's the primary focus. This one has a secondary focus, proprioception, maybe motor output, right? So focusing a little bit on like, can we start firing those muscles a little bit more? Can we feel it? In the example of like post knee surgery, um, can I start to fire my quads a little bit without pain? Kind of start working into that more and more and more before we get to phase two, because phase two is going to be a little bit more of a kind of movement based stuff. But still in phase one, the tertiary is voluntary activation, right? So that's the muscle strength. So primary, secondary, tertiary in phase one. Phase two, restoring those ADLs. The primary goal here is returning that person to their activities of their day. If we're focusing on that kind of ACL recovery, um, can can they start moving around? I think in the book they talk about without ability to be without crutches. So the these are extrinsic stimuli applied to the injury. So first is going to be focusing, primary focus is joint stability. So this is where we're starting focusing on motor control, right? We need to start stabilizing that place of the injury. Secondary, there's a double here, right? So this is the double. Secondary is full range cyclic loading, range of motion, and hypertrophy, muscle strength. So um, the tertiary on this one is we're not even thinking about tertiary, right? We're not really focusing on that piece of it. There's just two big pieces, right? So we're kind of lumping the secondary into just one thing. Phase two. Phase three is the returning to sports activities. This is very complex movements, right? We want to increase the complexity, the velocity, rate of force production, start doing on-field stuff. Um, in phase two, on-field stuff for a shoulder injury, phase two still is like, can they start moving their arm? If from a shoulder injury, can they start like mimicking a throwing motion? We're not throwing yet. We're just starting to apply that motion. We're in phase three now. We're doing it on the field. We're starting to incorporate it, right? So, primary goal of phase three: speed, agility, strength, right? We want to motor control and muscle strength. Those are huge here, right? We really have to be a little bit more complex with this sports activity stuff. Whereas like in phase one and phase two, you're still kind of like, all right, can we start applying load without pain? Now it's like, now let's start testing it. That's where the return to play guideline starts coming in this particular step. There's no secondary in this one. We're not even thinking secondary here. We're just primary goal, sports stuff, motor control, muscle strength. Can we start, getting in there? There's a tertiary, it's kind of confusing. Primary, no secondary, but tertiary is like manual therapies, right? Do you need to do your chiro, your ATC, your PT, or go in for your manual therapies, massages? Phase three, returning to sports. Phase four is prevention of re-injury. Main goal here is focus on the impairments and kind of functional limitations that are left over, right? If we're kind of leaning in between this knee injury complex of ACL, right? What are the functional things left over? Um, so we want to focus on kind of ingraining maybe new patterns for uh, returning to play, right? If you have an athlete that's returning to play from a knee injury, um, are there functional limitations that are left over that are not going to stop them from playing, but maybe might help them have avoid re-aggravating the injury, or maybe potentially a different injury from a compensatory problem, right? So ingraining new patterns plus focusing on that kind of power and endurance. Um, there's no secondary here as well, so it's kind of like primary, and then tertiary is maintenance and recovery. So motor control, muscle strength, still that's number one here. So um, acute phase one. Phase two is restoring ADL. Phase three is return to sport. Phase four is preventing those re-injuries, and they all have a different focus. So controlled, extrinsic stimuli, complex movements, and then sport-specific stuff. So 1, 2, 3, 4. A little bit more on the kind of very detailed nuances here.